is being used in major medical centers all over the world for minimal invasive surgery. The robot operates on a camera and 3 instruments. It's ideal for both complex and delicate surgeries, such as the surgical removal of the prostate gland.
Positives for the patient is with minimally invasive surgery is that they have less pain, they don't bleed with the operations, they have a very fast recovery with it, and we have, especially in prostate cancer, a far better chance of preserving their potency and their continence after radical prostatectomy.
Dr. Bangus says they expect to start operating on the robots as soon as October.
In the middle of October, 21st of October, we'll start doing patients with this machine, and then from there we'll go from strength to strength, and more doctors will train on this machine.
The multi-million rand robot was brought to South Africa by Earth Medical, a healthcare company. There are plans to eventually avail this technology to all South Africans.
Once we're up and running, I'm sure there will be mechanisms to introduce this to a far wider patient base once we have the system going and once we have the buy-in from medical aids and hopefully the buy-in from the state as well, eventually.
According to the producers of the robot, around 2 million procedures have already been undertaken around the world using this technology. Sbuhlela for SABC News in Johannesburg.
Gosh, isn't that amazing? Well, to learn more about this Da Vinci robotic system, we joined in studio by Dean Fawcett of Earth Medical, which supplies the Da Vinci technology to South Africa. Good to have you. Welcome, Dean.
Morning, Leanne. Thank you.
And this is absolutely amazing. I mean, when you look at this, the future of surgical, but you've been telling me this has been around for about 15 years, so this is not necessarily new.
No, it's not new technology, and it's very much proven. Obviously, the costs initially were a bit scary for some of the healthcare countries, but today we have robotic systems in excess of 55 to 60 countries around the world. So it's a significant moment for South Africa to have this technology now.
Yeah, it's amazing. I mean, is this technology only applicable to prostate operations? Because that's what we're seeing now. Or can it be used across the board?
It's a great question. It was the biggest procedure initially done was prostatectomy because it's a difficult area to reach in the pelvic area. But today it's used in gynecology, general surgery, ENT, which is ear, nose and throat surgery, cardiothoracic surgery, and also in some pediatric cases.
So when we were looking at the insert, I mean, I was asking you questions while it was going. We saw somebody actually using the system. Was that the doctor? Was that
Correct.
The doctor operating, I mean, in a completely different sense of the word, operating the machine?
Absolutely, and I think it's a great question and important point to clear up. It's not like your doctor walks in, pushes a button, and that does the operation, and he goes and has a coffee. Not at all. This is a tele-robotic interface.
Yeah.
So you have some brilliant surgeons today that either perform open surgery, where the abdomen is opened, or keyhole laparoscopic surgery.
Yeah.
Those two approaches have limitations that the doctor can't get beyond because of their tools. What Da Vinci has done is it's culminated the two. So you have a 3-dimensional high-definition image that's being portrayed back to what we call the console. I think you saw a picture of the doctor sitting with his head buried in something, and then their hands were moving in free space.
Yeah.
Now those hands actually move the tips of the little instruments on the robot, or what looks like the octopus, the bit with all the arms.
Yeah.
And in essence, what it allows them to do is access much more difficult to reach places, see structures a lot more clearly, and then because of the precision with the computer interface, do a much more precise operation.
It's amazing. So I imagine you could actually have a doctor operating. Do they have to be in the surgery, or can they be operating it from another country? I mean, it's such a bizarre question, but is
no,
it?
it's a common question. The technology is, in theory, is there, but that doesn't happen for one good reason, that the bandwidths and the computer or RT lines, if you like, are not sufficient. And you can't afford a millisecond delay if you were operating, let's say, on a patient in East London. But in the future, I have no doubt that we'll see that. But today, the doctor is very much in the theatre, but just about 3-4 meters away from the patient.
Amazing. I have to wrap the interview. Is it working?
It's here and it's ready to go. First patients will be done the week of the 21st of October.
21st of October. I know the media will be there and they'll be covering that one very extensively. Thank you. Thanks for chatting to us. It was really interesting. Dean Fawcett of Earth Medical, which supplies the Da Vinci technology in South Africa, new robotic surgery. Incredible. That's, I suppose, the way of the future, but it's here. It's now. It's happening. Let's take a break.